Good afternoon, everyone. It's Saturday, November 15, 2025, 1 p.m. Central Standard Time here in Champaign, Illinois. You're watching Co-op for Two. My name is Jesse. Today, you're joining me for a playthrough of the first patient, first of four, in a game called Medical Mysteries Miami Flatline. We have a little bit of history with this game series. We'll talk about it in a minute. Let me check in with the chat, see how everyone is doing today. Webcam looks busy today. Yeah, I think they must be playing some football or something while we're inside saving patients. YouTube says 22 concurrent viewers. You know, I used to be able to see how many people have liked the video. I can't see that anymore. That's unfortunate. If you do like the content on this channel, I would appreciate it if you gave it a thumbs up. Even more important would be if you left your comments on these videos after you watch them. Let me know your thoughts, especially if you disagree with me. Okay, let's talk about our plan for today and tomorrow, and then we'll go into a little bit of the history in this game. So I thought today, this is a little bit of an unusual schedule for us. I tend to prefer playing these games late at night, but I thought we'd mix it up a little bit. So today we're going to play the first patient in this box, which I believe should be a short tutorial case. In the first box from 2024, the first case was explicitly billed as a tutorial, sort of walked you through it. In this case, I can see that it's rated as an easy patient, so I suspect we won't have much of a problem with it, but we're going to take our time. It's been a while since we played. I'll go through all the rules. We'll relearn how to play. And then the question is, when we play the remaining patients. Now, I have scheduled a live stream for tomorrow, Sunday, which is our normal play-by-mail Dear Homes session, but I'm still waiting on a reply from them, so I don't have anything scheduled. And I know there are a couple people who are particularly interested in this game that we're playing today. So those of you who are interested, let me know if you think we should play the second patient tomorrow at 1 p.m. If not, we'll play it next week. But if everyone who wants to join for these and likes this one can let me know, I guess ideally now, but before the end of the stream, let me know if you think we should play case 2 tomorrow. If everything is the same with the previous game, this session will take us maybe a little over an hour or so. With that said, let's go over our history with Medical Mysteries. The first Medical Mysteries box here you see here, this one released by a company called Buffalo Games, sort of was an under-the-radar game that didn't get much attention when it was released. I think I picked it up at Target on a whim, I believe. Turned out to be my favorite mystery game of 2024. Part of that was because of how well it was done, but the other part of it was just how novel the setting and the mechanics were. But we all loved it. We played it very seriously on this channel. We did fairly well, although one patient we misdiagnosed, but loved the experience. I'm curious how many in the chat have played or watched our playthroughs of New York City Emergency Room box of Medical Mysteries. If you're curious, you can watch my spoiler-free review, which was about 45 minutes. And then you can watch playthroughs of all 4 patients on this channel. I think one patient took us about 3 hours, but most of the patients took a little under 2 hours. Anyway, I love the experience, and I've been waiting for this follow-up for at least a year. It's been delayed quite a bit, but it's finally come out. Now, it's not yet available in the US. I'm not sure why that is. But thanks to the Patreon supporters of this channel, and I hope we can all take a moment to let them know how much we appreciate them. Thanks to the Patreon support, I was able to pick up a copy from, I believe England is where it shipped from. A little bit more expensive. Well, quite a bit more expensive. I think I paid about $50. Probably when it comes out, $25 is about the normal price, which is very cheap. But anyway, thanks to the Patreon supporters, I can afford to pick up these games and spend a little more and also remain unencumbered by any relationship with any publisher. So these will be our unbiased opinions about the game. If it's half as good as the original, I'll be happy. Okay, anything else to talk about? I'm very curious how many joined us for the first box, New York City Emergency Room. Natalia says, I played New York City with my play group yesterday. We played Patient 2. It was fun, but some of us found it too easy. Well, let me show you something. Here is the box. You can see for the first game, New York City Emergency Room, Patient 1 is easy. Patient 2 is medium. Patient 3 is medium. Patient 4 is difficult. That's the rating on the original. Now, Natalia, I have to warn you, I think we played the first two patients and got a little overconfident. And then I think we may have messed up on Patient 3. And then taking Patient 4 more seriously. So it starts out easy, but the cases get harder. The cases absolutely get harder. Now, I think it's interesting to compare the two boxes here. So the new box is smaller. Same age, and I think same time estimate of an hour each. But now look at what's different about the patients. In the first box, we have patient 1, 2, 3, 4, ranging from easy to difficult, but 3 out of 5 star difficult. The new box has 4 patients, but the third and fourth look like they're combined. And the first patient is rated as medium, whereas the first patient in this box was easy. So I wonder if we're not going to get a tutorial. And then it gets to hard, which this case never got up to. And then expert, one beyond hard. So these cases seem to be more difficult. That is exciting. And a little bit nerve-wracking because it was not, by the time we got to the end of the New York City box, it was not super easy. Okay, everything on the back looks about the same as what we got in the first box. Patients tutorial. Okay, so this one does have a tutorial. Now I can't remember, actually. I thought the first patient was the tutorial patient in this case, but maybe I'm wrong. Maybe I'm wrong. Maybe the tutorial was... Now I can't remember. It's not so easy to see. One of the things we will do today is we will relearn the rules and we'll be paying attention and looking for differences between the games. I'm very curious. Okay. Natalia is reminding me that the tutorial was separate. Okay, so maybe we're going to get... Okay, so we may have a decision to make. I thought we'd be playing Patient 1, the tutorial. But the tutorial's different. So what we're going to do today then, since it's the afternoon, since we've got some time, I guess we're going to play through the tutorial and then we'll make our way to Patient 1 all in today's session. So maybe it will go for a little more than an hour. How many patients did the channel end up getting killed? I'm not sure anyone got killed on our watch, but we did great with most of the patients. One patient, we missed an important diagnosis. As Sarah says, I was there for the first box. Debbie says, patient 3's diagnosis was ridiculous. To be fair, I'm not sure about that. I think we took patient 3 in the first box a little too cavalierly. Marco says, the first 2 cases were easy. In each case, we missed some in details. The game indicated them as minor, but to us, they all seemed important and not to be overlooked. Being thorough seems like an obligation in medical cases besides the score. The third case was more structured and difficult. The patient survived the night, but at the end, we looked each other in the eye knowing we should have done better. Is that a kitty I hear? Yes, you do hear the cat. We took this game very seriously and we felt bad about patient 3. Okay, so you're hearing a cat in the background, and if you can listen to the specific meow she's making, now that meow means she's got her toy in her mouth, and she normally can just come right into this room whenever she wants, but she has a little bit of trouble pushing the door open with the toy in her mouth. So she wants someone to come and see that she has her toy. That's what she wants. She wants us to acknowledge that she has her toy. All right. The toy is an old sock, by the way. So, are we ready to get started here? Let's go ahead and open it. I mean, we have been waiting for this game, this channel. This is one of the few games we've been waiting for the last year after finishing the first one. And this is a good example of a game where it really was fun to play it with a group, because everyone is... it helps to have lots of opinions. Okay, the chat is notifying me of something interesting. Nelson says the tutorial is the same as in the first box. I see. Okay, so maybe we'll be skipping the tutorial. All right, well, it's been a year, so let's remind ourselves how to play. Maybe we won't play the tutorial, but we'll skim it. Nurse Judy, yes. Well, it makes sense, and it's fair for the tutorial to be the same, given that they're not even counting it on the box. But we are going to have to learn the rules. Okay, and then we've got our patients in envelopes. We might as well not peek at them. Let's take a look and learn the rules together. A little bit of a anatomy map here. Heart, liver, gallbladder, that green thing, pancreas, kidneys. Kidneys are at the back. Large intestine, prostate, penis, and testicles. You can see this is a little bit of an adult game. Stomach, spleen. There's a little spleen over there. There's the small intestines in the center, uterus and ovaries and bladder. Okay, let's learn how to play. I don't know if our memory is going to be good enough to remember differences, but basically this is the same structure. In fact, these may be identical. Well, we'll talk about that in a minute. These are the codes we look up when we do tests. I remember that, but let's learn how to play again. Okay. Welcome to Miami Flatline. It's always busy here, but there's enough time right now to give you a quick tour. You'll be working the day shift from noon to 8 p.m. We see real challenging cases no matter what day of the week. It's your goal with each patient, uncover the cause of their mysterious symptoms and help them survive. If this is your first time experiencing medical mysteries, it's best to follow the tutorial with Nurse Judy. Follow her directions and she'll show you how things work around here. Open the tutorial now, then be sure to return here and we'll complete your tour. Okay, so it says just play the tutorial and it'll teach us, and then we're going to get patient 1 and the rules. All right, even though we have recently played the tutorial, I'm going to walk through it quickly just so I remember everything, and it's been a while. Okay, so to play the tutorial, we need the contents of this envelope and the result codes booklet. Epilogue sheet stays in the envelope. Before you play, make sure all tutorial game parts are included. That's nice, a little summary. I don't remember if they had that before. Okay, so don't read the epilogue, it says. I don't remember, well, who knows what was, we'll never remember. My memory's not so good anyway. Okay, so we've got some tutorial cards. I do remember this girl's face. So we have played this before, but let's learn how to play as if we didn't. Because we're not in a rush. Let's appreciate this game again. Okay, so hi, I'm Nurse Judy. I see you're new here. Let me show you around. Your first patient is Luana Kapoor. Let's get her information together by collecting her intake interview, medical records, and status card. You'll also need story card 1, tutorial research sheet, results codes booklet, and a patient form to keep track of your actions. Okay. So we've got her sheet here. And on the front, it's her current medical stuff. And on the back, we have her admittance exam where she gets asked and tested for certain things. We've got a patient form. So every patient we get will get one of these. Every patient we get will get one of these where we track what we do over time. And that clicks by events, and every case will have some different medical tests and information on issues. And as the case gets harder, these will have more sheets and more medical stuff to know about. And then in addition to this admittance exam, we have a patient intake interview. Sometimes if the patient can't talk, like they're unconscious, their next of kin or the person brought them in will be doing the interview. Okay, and then it wants us to take story card 1 and status card 1. All right. Let's read. Nurse Judy says, put the rest of the items aside. Don't look at them until directed. Fine. Okay, so it suggests we start with the intake data. Luana's status card says she's in severe pain. Okay, so as I remember, we'll always have one current status card. And that might change based on how she's treated or how her condition evolves. And I think we're supposed to look at this side, not this side. So pay no attention to that. This is the side we look at. Okay, so her current status is in severe pain. And then these are options we have. So we could interview the patient, we can do a urinalysis, a blood test, an ultrasound, we can remove her kidney stones, we can give her morphine, and we can send her to some experts, urologists, gastroenterologists, and nephrologists. We can give her antibiotics, we could just remove her gallbladder. And then at certain times, as time goes by, these events will trigger, and we'll read in the book what happens. So given her current status, these are our options, but let's follow the rules. Okay, the current status card says she's in severe pain. Take a moment to review her electronic medical record. and intake interview. Now you can begin taking actions. Okay, so we'll start by reading her interview. Luana Kapoor, she's 53 years old, female. Each patient is a 53-year-old postmenopausal woman of Pacific Islander heritage. She grimaces in pain as she talks. I was gardening all morning. You know this Miami summer heat. I should have taken a break, but I had several large orders of herbs that I needed to fulfill for my Etsy business. I think I pulled a muscle in my back, and I'm pretty sure I got heat stroke too, because I almost passed out from the pain on the subway while heading home. I tried to take a nap, but I couldn't sleep, and the pain kept increasing. Finally, I realized I needed to go to the emergency room. Okay, she's in severe pain. She's grimacing while she talks. That's how severe her pain is. She thinks she pulled a muscle and got heat stroke. Okay, well, that doesn't jive. It doesn't sound like heat stroke and a back muscle is going to be responsible for this much pain, and it's increasing. Okay, so let's take story card 1 and status card 1 she's in. So maybe we start with that. All right, now, story card 1. All right, so we've got some options we could ask her about. We could say, tell me about your back pain. Where does it hurt? What kind of herbs are you growing? Nurse Judy says, some questions are more useful than others. Use your time wisely. Okay, so the whole mechanic in this game is limited time. You only have limited time to do certain actions, so you have to be efficient with your questions and your treatment, and you can make things worse. If you do the wrong thing, you can make things worse. And the scoring is quite comprehensive. Like, you'll get penalized for useless tests, you'll be penalized for not making good recommendations, etc. All right, let's go back. Let's take a look at her electronic medical records here. Female, 1.6 meters. Maybe if this was the USA localized version, it would be in feet. I'm not sure. We could check the New York City one to see if that's right. We'll just convert these. Maybe someone in the channel can convert these for me. Okay, she's a self-employed herbalist. So let's listen to her complaints. Back pain, 8 of 10, she says. She's diaphoretic. I guess that means she's losing water. She's sweaty. Face pale, and she appears ill. Here's her history. Recent illness, no. Travel, no. She's not taking any medications, and she doesn't have drug allergies. Now let's take a look at her heart rate. Now, you don't have to really know anything. You don't have to have medical backgrounds, and you don't have to do internet searches, because everything that you need to know about medical stuff is in these books. I think we're going to get another book at some point. So don't feel when you play that you have to go research like what stuff is on the internet. It could help you. I don't know if the game encourages it, but you don't have to. So here are her vitals. We'll read about this if we need to. Her body temperature, 38. So it's a little... this may be localized for the UK. So that's a little bit unfortunate, but we'll have to spend a little bit of time in the beginning converting so we know whether whether her temperature is abnormal, heart rate. I'm not sure what normal range is, but we're going to read about all this. Okay, now let's look at her past history. She's got hypertension. She's got high blood pressure. She's got hypercholesterolemia. She's got high cholesterol. She's got frequent urinary tract infections, none of which seem like they would cause severe back pain. She's got 2 children, healthy, both parents born in Hawaii. Okay, now let's look at the entrance exam. Okay, patient has a fever, 38.8. Looks ill, increasing continuous pain in lower back. I feel like this is she's got kidney. Like that was our kidneys at the back of the body. Maybe I'm just remembering that. Okay, she's cooperative. No respiratory problems. No changes in vision or hearing. No sore throat, neck stiffness, or tenderness. She's awake, alert, and oriented. Complains of a headache. That might be separate diagnosis of sunstroke. Heart rate slightly elevated, normal for an emergency room visit. No palpitations or chest pain. Normal blood pressure, no murmur. No muscle or joint pain. Normal, soft, non-tender, no palpable masses. Okay, so they've squeezed her stomach, nothing showing, nothing out of the ordinary. Nothing on her skin. It's not tender. Her skin looks pale and sweaty. No abdominal pain, nausea, vomiting, or diarrhea. History of frequent UTIs. She's postmenopausal. Last physical exam. So you might, there's very subtle stuff here. Like you could look at this, and if she had lost like half her body weight, then something might be up. As was pointed out in the channel, you'd be surprised what people come up with for excuses to why they're feeling some kind of way. Like you cannot trust what they say. People lie to the doctors, or they're embarrassed about something, whatever. Sometimes they tell us something and it turns out not to be true. Melissa says temp around 101.5. So Melissa sounds like she has some background knowledge. So Melissa is reacting to these things here. She's saying she's got a fairly substantial temperature. I mean, 101.5, that's a real fever. Oh, look at that. I didn't recognize this before. Did we already notice this? That these numbers are color-coded based on where they sit here? I don't think I remember that. So just by looking at this, you can see her temperature is elevated, but not super high. But her heart rate seems to be quite high. And her breathing is fast, quite high. That's very useful. Whereas her blood pressure and oxygenation is normal, green. And that's what Nelson was just pointing out. I don't remember noticing that last time. Maybe we can. Melissa says UTI can cause back pain if she has... Okay, Melissa, you can't keep using these words we don't know without explaining them. All right, let's go back to our tutorial now. Okay, her status is in severe pain. Take a moment to review. Now you can begin taking actions. Now, look at Luana's status card, SC1, which was here. It shows actions you can take, including running tests, prescribing treatments, or asking the questions on this card. You can see those are interviews, interview patient. All right, so you can run tests, prescribe treatments, consult specialists. That's these ones at the bottom here. Remember, there are lab tests listed on the back of the status card. You get 3 actions per 2-hour time period. Okay, so there's our thing here. So you can see if we wanted to ask her a question here, each question or treatment takes 1 slot of time, which we can record here. After 3 actions, there's an update. The update will tell us how she's developed. So at 1400, we're going to read this update, TAM, in the book. And here's our little reminder. Update at 1400, read the update. So here are the updates that trigger based on time. So if we don't fix something in time, it could get worse, etc. You could even have a patient die. All right. You get 3 actions per 2-hour time period. When you've completed 3 actions, you receive an update on the status of the patient. As the doctor, you decide which actions to take and in what order. For your first patient, Nurse Judy will walk you through the process. Okay, so the tutorial is going to tell us what to do and tell us all the actions to take. Now, we could try just going off on our own here. Now, so before we decide what to do, what 3 actions to do here at noon, we might want to read this medical, because I think she's got a kidney that might need to be removed, but let's see. Okay, so here's a little bit about kidney, which may be a little bit of a hint that this patient may have kidney problems. So there's a gallbladder attack. Inflammation of the gallbladder. CBC blood test may detect high white blood cell count. Ultrasound detect signs of gallbladder inflammation, possible gallstones. If there are painful gallstones, treat by removing the gallbladder through surgery. If left untreated, the condition may lead to gallbladder rupture and even death. Gallstones are hard particles that develop in the gallbladder, but her pain is in the back. But okay, well, let's keep going. Kidney infection. Inflammation of the kidney due to a bacterial infection. Symptoms include frequent urination, flank pain, I guess that means on your sides, fever. A CBC blood test will show a high WBC. Urinalysis will show signs of infection. Treat with antibiotics. If left untreated, the condition may lead to kidney failure. Oh, maybe I was thinking of appendix. But the appendix is on the side. Okay, so maybe not kidney. Urinary tract infection, inflammation in the urinary tract due to a bacterial infection. We know she gets these frequently. Burning on urination, she's not. Frequency of urination, she hasn't reported any of this. Abdominal discomfort, none of this. Certainly doesn't seem like this is it. But gallbladder, painful gallstones in the gallbladder. I mean, gallbladder doesn't seem like where she's reporting problems, does it? All right, let's keep going. Let's look at these tests we can run on her. We can run a blood test, check for signs of anemia, infection, or blood-related conditions. Ultrasound, we can image the organs. Urinalysis, check urine for blood or signs of infection. We could send her to a specialist, a urologist. A nephrologist is kidneys. Gastroenterologist is digestive. Procedures and drugs, antibiotics, morphine, or surgery. So we could give her morphine to treat her pain level. What does she say her pain level is? She gave us a number, didn't she? Maybe it's here. Back pain, 8 out of 10. That's pretty severe. All right, so the tutorial will actually tell you what decisions to make, but maybe since we've already played the tutorial once, we might do this on our own. Okay, so there are our choices here. We can ask her about her back pain. We can ask her the herbs she's growing. I mean, clearly we're not removing anything, but let me take a look at this again. Gallbladder. Blood test CBC blood test could detect high white blood cell count. Ultrasound will tell us gallbladder inflammation. Kidney infection. CBC blood test. So CBC blood test would tell us, well, both of these, high white blood cell is either gallbladder or kidney, but urinalysis would develop. So one of the things that we enjoyed about playing through this before is there's certain tests that you're sort of like, well, it's probably not this, but the risk, the worst case scenario is so bad that we're going to run this test. Like, you have to make real world decisions about this. Like, okay, it's probably not this, but it's probably just something that could be treated with antibiotics. But if we're wrong, she dies. So you got to think about what to do that to take care of worst case scenarios based depending on the odds. Gallbladder pain can also radiate to your back. I had my gallbladder removed from stones. The pain was in my stomach, not my back. Often gallbladder pain can look like heart pain, but everyone's different. CBC blood test would be useful for both. Morphine is strong. We should probably be careful about giving her that. Other painkillers might help more with the fever. Let's follow the tutorial and ask her a question first. Okay, I was trying to avoid looking at the tutorial because I thought we might enjoy just playing this game on our own. But okay, we're not going to take this one too seriously since this is a simulation. Let's ask her about her back pain. We'll play this case. We won't overthink it too much. So we've chosen to do BPA to ask her about her back pain. So the game is going to tell us what to do. I guess we're following the first instruction. Let's start by asking her a question. Look at story card 1. Find the result card next to the question matter back. Look up BPA in the result codes. Record your action. Okay, so we would look up here. BPA, is it per case? Yes, tutorial and patients 1 through 4. Okay, so try not to read stuff that don't belong. Take story card 6. So we go into our story deck and we take story card 6. Okay, tell me what about your back pain. Where does it hurt? I guess it isn't my whole back. I mean, I hurt all over, but the sharp pain I'm feeling is on the right side. Here, I'll show you. Luana puts her hand on her flank, the area between her ribs and her hips. She seems to be indicating the location of her kidney. Aha. So it's not like middle back. It's right on her flank, hips and ribs, and indicating, it seems, kidneys near the back of the body, as I suspected. And okay, so now that we think it might be kidneys, okay, I guess I wrote this wrong. The result is BPA, and we asked her question 1, and she said that it was near her kidneys. Now, let's take a look. If we think it's the kidney, it could be bacterial infection. Flank pain. CBC test will show high white blood count, but so will gallbladder. A urinalysis will show signs of infection, but she gets frequent UTIs, so I'm not sure. Treat with antibiotic. I guess ideally we do a CBC and a urinalysis. But what if she has kidney stones? Hard deposits. Urinalysis will detect blood. Ultrasound will detect kidney stones. Treat with pain medication and hydration, occasionally surgery. So I think maybe we do a urinalysis and see if there's blood. If there's no blood, then it's probably just an infection. If there's no infection or blood, then maybe we've got gallbladder, maybe we move along. If it's infection, it could be a UTI or it could be just regular kidney. So I'm inclined to do a urinalysis. We could do an ultrasound and jump right to the possibility that she's got kidney stones. All right, so we're all agreed. We are going to skip the tutorial and jump right to a urinalysis. She's going to start complaining of pain soon, but let's do the urinalysis. Okay, so we're doing a urinalysis, which is result code CPP. CPP, the test comes back normal. Well, that's a surprise. Huh. Urinalysis normal. Urinalysis will detect blood if she's got kidney stones. I don't think she has kidney stones. She doesn't have a UTI. And she doesn't have a kidney infection. Huh. Ultrasound would pick up gallbladder. Ultrasound would pick up kidney stones. But why is her urinalysis normal? Hmm. That seems to rule out all of these, but not gallbladder. But gallbladder and kidney are in totally different place, right? There's gallbladder, kidneys, but I guess the kidney and the gallbladder are not that far from one another. Of course, she could have something completely different. UTI can go up into the kidney. Let's go with the CBC. Not a kidney issue. Let's try a CBC. Give her something for the pain. A kidney stone can stab into the kidney. Gallbladder pain can radiate to the back. You guys want to do a CBC blood test, huh? I mean, a blood test will detect white blood cell, high white blood cell. So will kidney, but we've already ruled out kidney. So if we get a blood test showing high white blood cell, I guess we think it's a gallbladder. But why should we not just do an ultrasound? Because an ultrasound will pick up gallbladder inflammation and gallstones, so it might tell us which of the two. I think we do a ultrasound. The only question is whether we're going to have to give her pain medication soon. All right, let's do an ultrasound. All right, so we're going to choose to do an ultrasound. And notice for ultrasound, we flip over this card. So depending on what time you do these tests, different results. So we did an ultrasound in the first period, so UHD. Let's go look up what UHD says. UHD is story card 3. You share the ultrasound image with the gastroenterologist. Ah, not a kidney infection or kidney stone. Luana has gallstones. And from her symptoms, it's clear she has a gallbladder attack. Refer to the research sheets. Okay, so she's having a gallbladder attack. Now, I thought for the first tutorial that we only read this, but because we have a whole bunch more research sheets. But I thought for the tutorial we weren't supposed to read, we weren't supposed to need these. It sounds like she needs her gallbladder out though. Oh, gallbladder attack. Inflammation of the gallbladder. highway, ultrasound, possible gallbladder infection, possible gallstones. If there are painful gallstones, treat by removing the gallbladder through surgery. Untreated, she could die. So the story says that's what she's got. I think they got to come out. Gallbladder attack. It just says if they're painful, which there are, they're certainly painful, remove the gallbladder through surgery. Now, there are occasional places in this game where we slightly disagree with this. So, but we've done the ultrasound and she's got gallbladder attack. Okay, so I was going to give her morphine, but before we do anything, we got to read the update. So we go to this card. The update is TAM at 1400. I wish there was a place to write down here, TAM, to remind us. But let's go ahead and do it. TAM is story card 10. So I'm going to bet she's going to be in a lot of pain now. But that's okay. We know what's wrong with her. Update 1400. Luana begins to moan in agony as her pain increases to a 10 out of 10. Her condition seems to be getting worse. You need to figure out the cause of her symptoms. She seems to be in a lot of distress. If she wasn't in so much pain, this might be easier for us. Okay, so it is strongly hinting that we should give her some morphine, which clearly we should. Now, what I was going to say, though, is, like, we're just going to put her in surgery, right? So, like, aren't they going to give her anesthesia? Do we need to give her morphine on top of that? This is the part where you could sort of, you have to think a little bit gamey. Like, I think Nurse Judy is certainly recommending we give her something for her pain. And I think the morphine but is the morphine and the surgery going to conflict? You could argue, let's just send her to have her gallbladder removed and they'll give her pain medication. But I think maybe she has to wait a little bit for the surgery. So Melissa says the pain meds aren't going to affect her surgery. She can't eat they'll give her the pain medicine. She's about to go in surgery. I don't think give her morphine. So there's the little disagreement there. We should check the notes on morphine if Melissa wasn't here. Well, okay. So normally we have lots of reference material to go through. In this case, we only have this. So let's take a look. Morphine reduces the pain level, isn't contraindicated. Surgery doesn't say anything about it. So I think we're going to give her morphine, and then we'll put her on. This is the US. She might be waiting for that surgery for a couple hours. So we're going to go ahead and give her morphine drip. The result is PMI. Let's take a look. If it complains about we shouldn't have given it to her prior to surgery, then we'll bring it up with the hospital. Story card 9. You prescribe a morphine IV to help with Luana's pain. It acts quickly, and Luana is clearly much more comfortable now than when she first arrived. However, because her pain has been increasing, her condition is likely getting more serious. You need to figure out what's causing her symptoms. Okay, so good. Now she's changed her status. So instead of this status in severe pain, she's now in status 2, which is calm but condition unknown. So now notice you have different choices from before. Sometimes maybe actually in this case, exactly the same choices, but sometimes different results, although in this case not, at least not on the front. Okay, it's time for gallbladder removal, GBR. We're just sending her right in. We're telling her she doesn't have a choice. You can't leave it in. You may not survive. So GBR. Let's hope we didn't miss anything. I mean, doesn't matter if we miss anything. This is clearly has to be done now. Story card 12. I mean, this is not optional. That gallbladder has to come out. Congratulations, you have helped Luana survive. You call in the gastroenterologist to perform surgery on Luana to remove her gallbladder. Surgery is successful. Luana is now in recovery, doing beautifully. All that's left is to fill out your final report, which is pretty cool. Okay, so that's a success. And we got her treated even before this event, which could be dramatic. Now we have to do our final report, which is story card 13. Let's take a look. What is your diagnosis? What treatments did you provide? Fill in the final report on the back of the patient form and then read the epilogue. Okay, so here we go here. Now, we loved this. I love this part because based on reading some of the medical stuff in more advanced cases, you can put all kinds of interesting stuff here. Okay, so what we do know in this simple case is that she had a gallbladder attack. And our treatments were morphine, and then we removed the gallbladder. Seemed very straightforward. Now, recommendations you have. I love this part of the game. So recommendations, look at what it asks. What recommendations you have, drug prescriptions, future tests, lifestyle changes, other actions. So in this case, we might just look at this again. Okay, gallbladder. Is there anything we could recommend she changed her lifestyle? Not really. Doesn't seem like you got much control over gallbladder attacks. So on the other hand, we didn't ask about the herbs. Do we know anything about any herbs that could cause gallbladder problems? Not really. So I guess we don't have much advice for her lifestyle changes, huh? Should we tell her to check the herbs? Probably not. I guess maybe I'm going to tell her, just since you're an herbologist, research herbal interactions with gallbladder. Maybe we might advise, ask the, who does the surgery on the gallbladder? Was it the enterologist? The gastroenterologist. So I'm going to tell her to ask the gastroenterologist about living without a gallbladder. Like, do you have to behave differently when you have your gallbladder removed? Seems like it's got to do something, right? And Melissa says, hey, she may need some pain meds. Okay, so we'll add in here, we'll prescribe some non-opiates, pain relief. Okay, so we've given her recommendations, I guess treatments here, that belongs. The prescription for the pain medications go up here. Okay, so I've just asked her, check about herbal stuff, and then ask the gastroenterologist if there's anything you got to do differently when you don't have a gallbladder. Okay, so we've done the final report. Here it is. And now we're going to read the epilogue and learn. We're going to get scored is what's going to happen here. Okay, let's take a look. Talking to Luana, you discover her pain is focused on the right flank of her back. Her history of UTI suggests she might have a kidney infection. In addition, the CBC blood test shows a high white blood count, which could indicate several different conditions. That's why I skipped it. Your analysis confirms she does not have this life-threatening condition, kidneys, which I initially thought. An ultrasound reveals she has a gallbladder inflammation, gallstones. With her high level of pain, the gallbladder needs to be surgically removed. Now, let's take a look. It would be nice if they had a place for score here, but here we go. 50 points if she survived, 25 points if you removed her gallbladder, 20 points if you first checked she didn't have a kidney infection. We did the urinalysis. This is the stuff I love. So even if you happen to get the right, if you did the right thing, like if the moment she walked in the door, you removed her gallbladder, you'd be getting these points, but you'd be getting penalized for not doing stuff you should have done. Okay. 5 points if we offered pain medication, which we did. Now, minus 5 points if you tried antibiotics or kidney stone surgery. It seems like these should be different. Like minus 5 points if you did antibiotics and a lawsuit if you did kidney stone surgery. That should be like minus 100 points. Okay, but we got a perfect score. 75, 95, 100. All right, we got a perfect score on Luana. Let's not get overconfident. This was the tutorial which we have previously played. Now, let's take a look at this tutorial and see what Nurse Judy would have had us done. She said, first run a CBC blood test. No, I guess, yeah, she had us ask, and then I guess it was so suspicious of kidney. Actually, her second action was to talk to a kidney specialist. Okay, and then the third action is suspecting kidney, so she did a CBC. Conditions getting worse. Morphine helped her. Continue this case on your own. Okay, then we did the urinalysis. It was normal. She doesn't have kidney. 1600, time for an update. And then Luana has gallstones. Where did this tutorial learn she has gallstones? White blood count suggests she might have gallbladder issue. Run an ultrasound. Okay, so we were a little bit more efficient than Nurse Judy, but who knows? Let's see. Epilogue described the key details. There are many ways you could have reached this outcome. You could have consulted with one of the other specialists, run different tests. Your decisions really do determine whether patients survive. Patients don't always have a happy ending. Look at her status card. The update at 8 a.m. is the result code XPL. Look it up to see what would have happened had you taken too long to address her condition. Okay, so it's saying just as a test, take a look at her card here, and it says, what if she had remained in severe pain all the way up from noon? The update at 8 a.m. That sounds like a little bit of a bug. I think it meant 8 p.m. because she doesn't make it all the way to morning. But if she had gone from noon to 8 p.m., this is probably maybe from New York case. But anyway, what it's saying is if we had gone all the way to 8 p.m., not 8 a.m., but 8 p.m., we would have read XPL. XPL says, take story card 14. Okay, if we hadn't figured out what had happened and 8 p.m. had come around, then we would have read this. Luana suddenly pales, then collapses. The doctor just coming out to shift orders an ultrasound as he tries to keep her stable. When the results return, he says she has gallstones. Looks like her gallbladder has just ruptured. She needs immediate surgery. You watch as they wheel Luana away to the surgery room. You wonder if she will make it. but it's out of your hands now. All right. So there you have it, the tutorial case. We played for an hour. We replayed the tutorial. I'm glad we did. So all of these cards are done. We will never use these again. We can put them away. Guess I'll just resort them now. You might be asking, well, you can ask whatever you want. Normally I would do this offline. Well, I suppose what we're going to do now is we're going to take a break. We've played the tutorial case, but we still haven't played patient number 1, which we're going to play when we get back in 8 minutes. I'll see you then. All right, we are back. We've just played the demo case, reminded ourselves how the rules work. Now we're going to glance through the post-tutorial rules, and we will start patient number 1. Patient 1, Zoe Williams. Once you've completed the tutorial, you're ready to start your shift. Select a patient. We recommend starting with patient 1, Zoe Williams. Leave the other patient envelope closed. Make sure you have all the materials listed on the patient envelope. We're just going to assume that these are all included. Read the intake interview. Okay, so we've got a big envelope here. We've got a big stack of cards. We've got, an epilogue, which we're going to leave in the box and not read. And we've got the interview and the intake form. Okay. Read the intake interview, electronic medical record. Pay attention to small details. Familiarize yourself with the research sheet. You'll find these in the envelope called research rules. So that's the tutorial is a self-contained thing. The real game has all of these things. And these are not double-sided sheets. These are whole pamphlets. So these are likely to be identical to the New York thing, but there's a lot to read over here. And we will want to take very seriously those documents, but let's just put that aside for a second. Familiarize yourself with them. At least we'll glance through them so we'll know what we have option. No need to read them completely through right now. A quick scan will do since you can refer to them anytime you want. Look at status card 1. Okay, so let us take a look here at Zoe Williams. 4-year-old little girl. Zoe sits in her father's lap when you enter the examination room. Playing with a ribbon next to them is another girl, perhaps 7 in age. You introduce yourself. Zoe's father nods and says, "I'm Daniel Williams, Zoe's father." You squat to get down to Zoe's level. Zoe looks at you, then turns away, gripping her father's hand tightly. "Hi," says the other girl, stepping in close. "I'm Jasmine, Zoe's half-sister." "Give the doctor some space," says Daniel. Then to you, "Zoe has Don't tell," says Zoe, hiding her face. Daniel shrugs to you. She's never been to the hospital before," says Daniel. "There's nothing to be scared of, honey. The doctor's here to help." Zoe squirms in his arms. "Hey, chillax," says Daniel. "You're gonna be okay. Are you still tired? Did you two stay up late last night talking?" "No," say both girls together. "Well, you've been acting like you need an extra nap." You ask why they're in the emergency room. Daniel says, "She's got something up her nose." Zoe cries out as if she's been betrayed. "We were getting ready to take..." Oh, is this the father? "We were getting ready to take Jasmine to her father's house when Zoe came to me crying with her finger up her nose saying, 'It hurts, it won't come out.' I tried looking up her nose with a flashlight. I can see something up there, but I couldn't tell what it is." To Zoe, he says, "Will you tell the doctor what it is?" Zoe shakes her head. "I tried to get it out using tweezers like I saw on the internet, but she was moving around too much, so I decided to bring her here to see what you all could do. I want Mom, says Zoe. Mom's on a business trip, remember? Says Daniel. She got on a plane this morning. She should be landing in Chicago later. Daniel burped suddenly. Excuse me. My heartburn has been acting up something awful. You ask if Zoe has any other symptoms. She's been really tired in the last few days, says Daniel, but that's got nothing to do with what's up her nose. You notice bruises on Zoe's forearms and shins more than you would expect to see on an even active little kid. You ask if there's anything else he wants to tell you. No, says Daniel, other than having something stuck up her nose. She's a perfectly healthy 4-year-old. What a weird case. Is there child abuse going on? So something up her nose, she's extra tired, but she's quite attached to him. She's shy about being at the doctor. There's 2 girls here, Zoe and her father, and Jasmine, Zoe's half-sister, who's 7, who's more social. This whole thing with the mother on a business trip. Then this burp. Sudden burp. What does that mean? Nothing? Heartburn? Is he nervous? Is he lying? Is that why? Bruises on her forearms and shins. Is that where a girl gets abused? Okay, story card 1, which is her status, something in her nose. It feels like maybe we're going to have some child abuse thing. So here's story card 1, our choices for interviewing. Zoe's shy, hides behind her father when you ask her a question. She even refuses to answer her father. I'll answer any questions you might have, Daniel says. Okay, so we can ask the father, has there been any past incidences with objects in the nose? Tell me more about Zoe being tired. Zoe has a lot of bruises. Is she being bullied? What is Zoe's home situation? Do you know if Zoe has any genetic disorders? Spend 1 action per 2 questions. I wonder if that's what the tutorial said as well, if we could have asked 2 questions. But okay, so 1 action, 1 time block, we actually get to pick 2 questions to ask. All right, let's take a look at her admission exam. Alert-oriented, foreign object in the nose, bruises on the forearms and shins. She's in a good mood, cooperative, although shy. No shortness of breath. Everything, right nostril occluded with foreign object. He tried to get out tweezers, it didn't work. She's fine, she's got full strength, regular heart rate, normal muscle, no abdomen issues, no edema, swelling, no, but she's got bruises on the forearms and shins. Bruises on forearms and shins, that's a weird, that almost feels like it's sports related, like for playing. Information obtained from father, all systems normal except she has been napping after school. Maybe she's being bullied. Immunizations are up to date. Let's take a look at her vitals here. Everything is green. She's completely fine, but she's got general fatigue, foreign object in nose, bruises, no recent travel, no known allergies. She's AB positive. She's got a history of high blood pressure. She lives with father and mother, half sister, same mother. The half sister lives in the home half of the time. Is her sister responsible for abusing her? And has her sister shoved something up her nose and is punishing her? Hi, the other girl, says the other girl, stepping in close. I'm Jasmine, Zoe's half-sister. Give the doctor some space. I wonder if it's the other sister who's doing this to her. And that's why she's holding on to her father. And he says, are you two staying up late? No, say both girls. Okay. Let's return to following these directions here. Okay, status cards are actions you can take. We already know about that. These are just reminding us of the rules. 3 actions per period. Run a test, prescribe drugs, consult a specialist. Recording your actions. Then you do the events. You look up the things. If you're in the middle of an emergency, when it's time to receive an update, do not take the update. Instead, receive your first action for the next 2-hour period. Once the emergency has been resolved, take the update. Your goal is to get the patient to survive your shift. When you succeeded, you'll get a story card saying they've survived. Okay, remember, our job is to get them to survive our shift in the emergency room, not to fix everything. You have 8 hours to help your patient. Some cases may be particularly challenging. If you reach 8 p.m. and need more time, you can keep going, taking as many extra actions as you need, but you'll receive -5 points for each overtime action you take. And use that last result code. Fine. So even if we take longer, as long as the patient doesn't die, we can keep going. -5 points for each overtime action. Okay, make the wrong decision, they might die. Final report, fill out the back. List the cause and the prescriptions. It is possible for your patient to survive your shift without having figured out what the condition is. If this is the case, you can continue to run tests until you're confident. And then read the epilogue. If I'm stuck, what should I do? Your goal is to make sure the patient survives. Here are the steps you can take. Review the data. Prioritize symptoms. Determine which symptoms are the most serious or potentially life-threatening. Treat them first. Understand the possibilities. Gather new information. Narrow down the options. Prescribe treatments. Make sure you've addressed all your patient's symptoms. Even the smallest detail may be important. If you're still stuck, consult a specialist. Confirm you've taken all the updates you're supposed to. Confirm you're using the correct status card. Make sure you've done every action. Confirm you've read the result code. All right, well, that's it. Here we go. Where's our status card 1? I do wish they had put these in slightly different order. Okay, so here's our status card 1. Her condition is she's got an object in her nose. We can interview the father. We can see his things here. We can run various blood tests, viral tests, abdominal thrust, distraction, suction, CPR. These are the main actions. And then we can consult people, including a social worker. All right, before we make our decisions here, we're going to do what the game suggested, which is go over these and familiarize ourselves with the basic stuff here. So we're going to take a little bit and go over, familiarize ourselves without reading all of these. We're going to see what we have available to us. So we've got a research sheet. What is this? Conditions, legal, and genetics. Okay, so we've got a research sheet of conditions. Acute kidney, anemia, attention deficit, anemia. These are blood anemia and aplastic anemia are blood issues. Ataxia is muscle motor control, an autoimmune disease, back pain, toxins produced by algae. kidney disease, a concussion to the head, dehydration, diarrhea, edema is swelling, fluid trapped in the body, reflux disease, hyperkalemia, potassium is too high, carenia brevis, brevetoxin, kidney failure, kidney infection, kidney stone, lupus is an autoimmune disease, myalgia is muscle pain, necrotizing fasciitis, infection where the flesh around an open wound dies. Yikes. Neurotoxin shellfish poisoning, nosebleeds, opioid overdoses, kidney disease, rebound overdose. After an opioid overdose is treated with naloxone, the naloxone wears off before the original opioid level, so they get opioid again after the naloxone wears off. Scurvy, vitamin C deficiency, sepsis, infection, spinal epidural abscess, collection of pus forms between the spine and the spinal cord. Surfer's myelopathy. Can someone jump in if you notice differences with New York City Medical Room if you've played it recently? There's a spinal cord injury that surfers get, bacteria that comes from raw oysters, urinary tract infection, white coat hypertension. This is if you're nervous about seeing doctors. Someone just mentioned this in the Discord channel when Teresa said she was scared to go to the dentist. White coat hypertension. Okay, so here's some legal issues. Health insurance, the HIPAA Act, that you protect the privacy of patients. We've got, this is surely new to the game, Florida statutes, chapter 64D3. Certain infections such as cholera and vibria must be reported to the Centers for Disease Control to prevent additional outbreaks. So if we ever get a patient with this, we have to remember to put in our final report that we're notifying the state. Section 7 of Public Health Law prohibits the release of records to parents concerning the treatment of a minor for sexually transmitted diseases or abortion. So we got to make sure we don't tell the parents certain information from the kid. Overdose may not be arrested. A person in need of medical care for drug. So if someone comes in with an overdose or a friend with an overdose, you can't arrest them. Child protection here. This one sounds relevant for us. Abuse, abandonment, or neglect of a child must be reported. Miami Hope Hospital requires staff to consult a social worker to assess and identify possible abuse, abandonment, or neglect. Report suspicions to your shift lead. So not only would it be good practice, but we could get in trouble if we think there's abuse and we don't talk to that social worker. And we saw there is a social worker entry here. Genetics. Okay. Anemia. So we've got genetic blood disease, genetic disorder, recessive and dominant, Huntington's disease, which gradually gives you dementia, kidney disease, that's genetic, Tay-Sachs disease, recessive genetic disorder in which growth and development are delayed. Okay, so that's our conditions. Let's take a look at this research sheet on brain health, blood, and procedures. Okay, so we've got an aneurysm in the brain, brain atrophy, shrinking of the brain, a cerebral microhemorrhage, microbleeds in the brain. We've got a confusion and lethargy, encephalitis, a swelling of the brain, epilepsy, hematoma, which is described later, hemorrhagic stroke, bleeding in the brain. That causes a facial droop on one side that you see when people have strokes sometimes. Meningitis, inflammation of the membrane surrounding the brain. And spinal cord. Meningitis bacterial, caused by bacterial infection. meningitis cryptococcal, which is a fungal infection, meningitis. So all of these meningitis, in general, meningitis is inflammation of the membranes surrounding the brain and spinal cord. And then you've got different causes: bacterial, fungal, and viral. Panic disorder is an anxiety disorder where a person regularly has sudden panic attacks. Status epileptics, these are seizures, epileptic seizures lasting more than 5 minutes. A stroke. Then we've got this is continuation of a stroke and how to treat it. Temporal dysfunction, temporal lobe of the brain is not functioning properly. Traumatic brain injury or head trauma. Then we've got blood alcohol, blood transfusion, bone marrow biopsy. Creatine is a waste product in blood from muscles. Blood type. Look at this little thing. I don't remember this, but this shows you who can donate to who. Is it showing you who can donate to? No, it's showing you how it's inherited. So if the child's blood type is A, then and the mother's is A. If the mother's is A and the father's AB or AB, then the child would have A, B, or O. Looks like it could vary. All right. Blood urea nitrogen level. Kidney functioning. Hematoma is a pooling of blood caused by damaged blood vessel. Red blood cells carry oxygen. White blood cells help the body fight infection. Here are some procedures. Abdominal thrust, emergency technique to clear the airway of someone who's conscious and choking. Cardiovascular life support. That's to give someone who has a heart attack or heart problem. An ambubag is a bag mask that forces air through the nose and mouth. That's when they push the thing and do that. Biopsy, remove samples of tissues for analysis. Blood transfusion, if someone's lost blood or something. Bone marrow transplant. Brain surgery to remove an aneurysm. CPR to revive someone. A crash cart is a wheeled unit carrying medicine and equipment for emergency situations. Debridement, surgical procedure for the medical removal of dead, damaged, or infected tissue. That's like before you have to amputate, spider bite, or calluses. Dialysis removes excess water and toxins from the blood during kidney failure. Distraction, to distract kids before you do something. Dress wound is to clean and bandage. Monitor patient. Suction to draw out an object. Surgery to remove, repair. Sutures, tissue culture, take a sample from the skin to test it. Trepanation, trepanning or making a burr hole, procedure where a hole is drilled or scraped into the human skull to relieve intracranial pressure when fluid builds up. Tweezers, use of tweezers to remove an object stuck inside the nose. How's the chat holding up during all this reading? Natalia says the material is slightly different than in New York City. There's no ataxia or child protection info. Anemia mentions bruising as a symptom. Do not remember any genetic disorders either. Debbie, you can tell you're UK-based. Extra letters and words. Ataxia is possible too if that makes her clumsy and she trips or falls down a lot. Interesting. Our first action should be removing the foreign object from her nose. Yes, I think so, for sure. But we need to keep reading these. I know you guys want to play, but on this channel, most of what we do is read. Okay, let's keep going. Let's just remind ourselves some drugs. So we've got mild pain, acetaminophen, heart regulation, antibiotics, amphetamine for ADHD. Amphotericin, which is for fungal infections, antibiotics. Got various antibiotics. Azathioprine, immunosuppressant. Artemisate, malaria, aspirin, beta blockers to slow the heart rate, blood thinners to prevent blood clots, more antibiotics depending on the treatment, chloroquine for malaria and HIV, heartburn, stomach ulcers, cimetidine, ciprofloxacin, another antibiotic, clarithromycin, antibiotic, more antibiotics, codeine for pain, contrast dye that you give before MRIs, doxycycline antibiotic again, epinephrine if they have allergic reactions, escitalopram for depression and anxiety, fentanyl, synthetic opioid, that's what people are dying and overdosing from, fluticasone is allergy, general anesthesia, gadolinium is another dye for MRIs, heroin, ibuprofen, an anti-inflammatory, IV fluids for dehydration, labetalol, high blood pressure, Lipitor lowers cholesterol, lisdexamfetamine for ADHD, lisinopril for hypertension, but could give you low blood pressure, lorazepam for anxiety, midazolam for anxiety, if we're going to give them a test. Although it's counterindicated. That's another thing. You have to always be watching out for counterindications and bad interactions. Morphine, naloxone, and Narcan for overdoses. Naproxen is an anti-inflammatory. Narcan, that's for opioid overdose. Nimodipine, if we have a ruptured brain vessel. Nitrofurantoin, more antibiotics. Nitroglycerin for heart, angina, chest pain. Methadone for contraceptive. NSAID is for anti-inflammatory drugs like aspirin. Omeprazole for stomach acid. Opioids. Oxycodone, another opioid, pantoprazole for stomach acid, prednisone to reduce inflammation, praziquantel for anti-parasitic, if you get parasites, sodium nitroprusside lowers blood pressure, supplements are shown separately, synthetic opioids for pain. Then we have tolvaptan, slows kidney function. TPA clot buster, I don't remember ever reading about these. Patients having a stroke for a blood clot, you got to give it to them right away. Vicodin is a prescription opioid. Zyrtec for allergies. Okay, then we've got some information on vitamins and supplements. Carnivore diet. Folate is vitamin B9. Guarana is an energy supplement that's full of caffeine. Magnesium is a mineral. Potassium is another mineral. Selenium is a nutrient for metabolism. Vitamin A, vitamin B12, vitamin C, vitamin D. Generic supplements. Zinc is another mineral needed by the body. Okay, so that takes care of that. We just have one more to go. Is that right? No, let's see. We read this one. One more to go here. Tests, specialists, and heart health. So here are some various tests you can run. An angiogram to detect aneurysms, blood test BAC, blood alcohol content, blood test CBC is a complete blood count test. Blood test Chem7 measures 7 substances in the blood. Blood test DEB checks for very specific Fanconi anemia. Blood test a whole drug panel to see if they've got any illegal drugs. Blood test for HbCO to measure carbon monoxide poisoning. Blood test, that's an interesting possibility. Now notice that our girl was in a room with her half sister, and the half sister's fine, so she doesn't seem to have any bruises. Blood work. Tomography is X-ray images, giving you even more detail than normal X-rays. Lab toxicology for lots of stuff that could be toxins. Echocardiogram is heart conditions. Electrocardiogram, more heart conditions, maybe easier, cheaper. Electroencephalography is electrical activity in the brain. Lumbar puncture to search for meningitis and cancer of the spine or brain. MRI is images inside the body. A nutrient panel to see what vitamins people are missing. Pelvic exam, for you might check for damage to the sexual organs or etc. General physical exam, pregnancy test, stool culture to look at their poop, to look at any issues, infections, parasites. Synthetic opioid to see if they've been taking any opioids. Synthetic opioids like fentanyl. Ultrasound to look at inside body stuff. Upper endoscopy, which goes into the upper digestive system. Urinalysis for infections, viral tests, hepatitis B, HIV, etc. X-rays, again, inside the body. Specialists, cardiologists for heart, dermatologists for skin, hematologist blood, infectious disease. A nephrologist is a kidney specialist. A neurologist is brain spinal cord. Pharmacist, psychiatrist is mental health, then they can prescribe. Pulmonologist is for lungs. Radiologist is for doing all the scans, the x-rays, the MRIs, etc. Social worker especially for children and elders. A toxicologist for drugs, and a urologist for urinary tract. And we've got some heart health terms here. Arrhythmia is irregular heartbeat. Cardiomegaly, enlarged heart, sign of another condition. Cardiomyopathy, thickening of the heart. Endocarditis, infection of the lining of the heart. Flatline when they have no heartbeat. Heart murmur, rapid choppy blood flow through the heart, can develop or be a part of a genetic predisposition. Hypertension is high blood pressure. Myocardial infarction is a heart attack. Stenosis is abnormal narrowing in a blood vessel or other organ. Stenosis of mitral valve, narrowing of a valve inside the heart that makes it not open and close fully to pump blood. Thrombus is a blood clot that is at risk of being dispersed when blood is pumped. I guess if you have a blood clot and it gets loosened up and it travels and gets stuck somehow in the brain or something. Troponin, protein found in the heart, normally not found in the blood, only released in the blood when the heart is damaged. I think that's how they see that if you've had a heart attack, they look for this. Causes of elevated troponin include myocardial infarction, etc. Then we have some tests you can run. Did we already do these? Blood work? I feel like we did these. Yes, we did these. Okay, that's it. So we've gone through to give ourselves some idea of all the tests and conditions and stuff. You can see lots of dense information that might be important. We can go back to the K. Okay. Melissa says we should ask the questions first. For example, they might have hemophilia or something. You need to ask, she is breathing fine, not in distress. If you take that out and she has a bleeding condition, it may cause damage. Okay, well, let's talk about it. Does seem like a good thing to do is to answer questions first. We don't know what's in her nose. She's shy. She's not answering questions, and she's got her bruises. So let's take a look at our choices. So we could just use the tweezers and try to take the thing out of her nose right now, but it does make sense to try to ask some questions first. 2 questions we get for 1 action. Tell me more about her being tired. If she has a lot of bruises, is she being bullied? What is Zoe's home situation like? Do you know if she has any genetic disorders? Has there been past incidences with objects in the nose? I mean, it's hard for me to see a real scenario where taking this thing out of her nose is going to cause a problem. I mean, even if she gives her a nosebleed, what's the worst that can happen? But it does seem like maybe if we can get some information about what could be up in her nose, it might help. I just don't see a scenario where we're not pulling this thing out of her nose. But let's ask this question. Do you guys want to ask another question? She may have a blood clotting disorder. You have to ask about the bruises. You guys are just, I mean, you're on a very, I'm not saying it's not possible. It just seems like such a long shot. And even so, like, if she's got a blood disorder and she bleeds too much, we'll put some cotton up in there, just like you would treat a nosebleed. I'm not sure why it would matter that much. But I do think we should ask about the bruises. So let's ask about the nose and ask about the bruises. He's not going to know anything more about her being tired. He's asked her, did you girls stay up late? Like, he doesn't know she's got some problem being tired. He just says recently. So I'm going to go ahead and ask questions since you guys are so hot on it. But I'm going to ask about the nose. Question 1. And I'm going to ask about the bruises to see what he has to say. So we get 2 questions. 1. I'm going to ask about 1 and 3. So we've got DNN and ZKF. I mean, I have to ask about them. Even if we think he did them, we're going to have to ask about them. So let's take a look about things in the nose first. Story card 2. Okay, we've asked him, have there been any past incidences with objects in the nose? He says, it's the first time Zoe's put something up her nose. I still can't believe she did it. Kids do the strangest things. I mean, what are they thinking? Hey, I could just stick this up my nose. What a great idea. I just don't get it, he says. Okay, never done it before, according to him. ZKF. ZKF. Story card 4. Okay, we've asked him about the bruises. Zoe has a lot of bruises? I guess she does, but isn't that normal? She's got a crazy amount of energy. She's always running around, especially on days when her sister Jasmine stays with us. Jasmine has 3 years on her, just like my brother had on me. I remember those 3 years making a huge difference when my brother and I roughhoused together. And if she was being bullied in school, they would let us know immediately. I do worry that the sister is up to no good. All right. Melissa says, I'm out. I'm not enjoying it. I'm just screaming at the screen. Well, this is a little bit of an issue we had the first time we played too. The medical people with medical knowledge had some bad reactions to the game and perhaps the way I'm playing the game. So I mean, what's the point of having someone who knows what they're talking about if you won't listen to what they're saying? Okay. Well, I suppose you could say this. You could say, look, there's no emergency. There's no rush. She's not in distress, so let's spend time talking. And perhaps there is some rare genetic disorder. But this might be a good time to just talk about the general nature of playing these games. It's sort of a group effort, but it's not always 100% group effort. Okay, so I'm going to defer to the chat a little bit, especially now, because as I said, there's no rush, there's no emergency. We might as well ask a lot of questions rather than just go in there and start pulling something out. I think in real life, I just go pull it out, but okay, fair enough. Let's ask, in fact, do we have this green screen up here? Okay, we're not in a rush. Let's ask a bunch of questions here. Why not? She's fine. You could also think of it differently. Maybe, all right, let me try to rationalize this a bit. I can see how this watching this stream can be frustrating for people. I understand if it's frustrating. Like all the games we play here, probably your best thing is to play these games and then watch the live stream afterwards. But let me make a different case. We're unsure of what's going on with the bruises, right? So probably in such a situation, we want to sort of drag things out a little bit. We want to spend more time talking, getting a feel for these people. If we suspect there could be some child abuse, maybe the more questions we ask, the more information comes out. Shouldn't be in such a rush. Maybe Zoe will calm down a little bit. She'll be able to talk to us. So let's take our time here. All right, we're going to ask 2 more questions. I'm going to ask about genetic disorders and about, I don't see how he's going to volunteer no information about her being tired, but let's for sure ask about the genetic disorders that you're so worried about. And if he's asking if they're up, I guess he could tell us how long she's been tired for. Okay, let's ask. Go ahead. Home situation. We know she spends time with the sister some of the time, but okay, let's go ahead. So we've got GKU and WSV. I wish they didn't make you cram everything in here. Okay, here we go. GKU. Genetic issues. GKU story card 8. Zoe's father says, when we found out Sandra was pregnant with Zoe, we both had genetic testing done to see if there were any genetic conditions to be concerned about. I can pull up the results on my phone. Okay, let's take a look at this. So the father is a carrier of Fanconi anemia. The mother is a carrier of Huntington's disease, and the father is a carrier of Tay-Sachs disease. Okay, so let's go look our genetics thing up. Let's see if we have information on these. We read about some of them, didn't we? So we're looking for Fanconi anemia, Huntington's disease, and Tay-Sachs disease. Okay, here's Fanconi anemia, a recessive genetic disorder that leads to aplastic anemia. Children born with it tend to be smaller, have birth defects, low numbers of red blood cells, white blood cells, or platelets, tiredness, frequent infections, bruising, nose or gum bleeding. Okay, so that kind of matches her symptoms of tiredness and bruising, nose or gum bleeding. So there is a specific test for that if we think she might have it. Now look, recessive disorder. Does that mean that if it's a recessive disorder, does it mean that you don't need both to have it? What? Oh, here it is. Genetic disorder recessive. Both parents test positive. Children have a 25%. If only one tests positive, 0%. Okay, so there you have it. Look at that. Anemia, the mother does not have Fanconi anemia, so it's very unlikely that she has it, unless there's a dispute about, unless they're lying about the parents. We both had genetic testing. The mother, it's definitely the mother. Could, like, if you thought that there might be a different father, that wouldn't matter. The mother doesn't have it. I think that means she doesn't have Fanconi anemia. Like, you could imagine the mother has lied about who the father is, but it's hard to lie about the mother. So I don't think she has Fanconi anemia, because Fanconi anemia is a recessive disorder, and recessive disorder, if only one has it, you don't get it. Okay, now Huntington's disease, the mother has it. Let's see. Dominant genetic disorder. Dominant means even if only one parent has it, 50% chance. So this girl very well could have Huntington's disease. Let's see. Dementia, loss of ability to speak, start at any age, seen at the age of 40. Okay, so that's not a concern of ours. What about Tay-Sachs? Recessive, so both need to have it. Growth and development are delayed. Doesn't seem like any of these are relevant for us. Okay, nice, cool, very cool. If I knew we were going to get so much genetic information, I'd probably be asking this of everyone. Okay. WSV. I mean, how cool is that, though, that they've got the recessive and the dominant? Okay, WSV is story card 3. So we've asked about her tiredness. Let's see what he says. Now that I think about it, Zoe has been tired for a while. She's been taking naps sometimes after school. Is it something I should be worried about? Again, this kid seems to never stop moving, so I didn't think anything of it. I thought she was just wearing herself out. So he doesn't know as expected, but do we have conditions that fatigue, anemia? Is she taking drugs? That would be another thing that would slow her down. She could be taking drugs. She could have gotten drugs from somewhere. I mean, she seems shy. She doesn't seem like she's not like dozing off, passing out. So we could waste a whole time slot to ask this last question about the home situation. I think it's time to distract her and then try to use the tweezers, even though he couldn't use them. I'm inclined to. It's a weird situation because we only have one click until this update, but I think if we don't distract her, she's not going to react well to tweezers up her nose. So I propose we distract her and then do the tweezers, but something may change. Or we could waste a whole time block just to ask her about her home situation. I guess I'm a little curious about her home situation because of the... All right, I'm going to do what everyone was complaining I wasn't asking questions. I'm going to do you one better. We're going to ask all these questions. We're going to waste a little time here. And we're going to ask her this last question. Very inefficient, but we're going to ask her her home situation. Question 4, which is going to eat up this whole time block, just because we're trying to slow things down a little bit to learn a little bit more. JFJ. I hope you guys are happy now. JFJ is story card 5. Zoe's home situation is great. Chandra travels quite a bit, but I work from home 3 days a week as a programmer. Someone's always at home with the kids when they're back from school. When Chandra's not traveling, she makes sure to give the kids plenty of one-on-one time, and we're doing something as a family nearly every weekend. This guy seems like a good dad. I don't think there's any child abuse going on here. I still suspect the sister, half-sister, a little bit, but he didn't give us any more insight. Now, we've got an update, so let's go ahead and see what's happened here. DEX. As you consider your next step, Zoe laughs at something Jasmine says. It's a cute little snort of a laugh, but quickly evolves into a choking cough. Nurse Judy gently pats Zoe's back until she stops coughing and calms down. Do you still have that object in your nose, says Nurse Judy. We should really get that out of there. Take story card 12. Daniel excuses himself. I need to call Jasmine's father and let him know what's happening. He dials. Hey, Michael, it's going to be a while before I can drop Jasmine off. Zoe's in the emergency room. No, nothing serious like that. She put something up her nose. It looks like we're going to be here a while. Okay. This just got a little interesting, and actually, now I think, now I need to, now I need to pause for a second. because I think we need to rethink this a little bit. So let me just read that again. As you consider your next step, she laughs at something, sort of a laugh, like you suck in, evolves into a choking cough. Pats her back. Do you still have that object in your nose? We should get that out of there. So something has occurred to me. I tried looking up her nose with a flashlight. I can see something's up there. I couldn't tell what it is. Will you tell the doctor what it is? She shakes her head. I tried to get out with tweezers, but she was moving around too much. So surely we're going to distract her. But what is she embarrassed about? Give the doctor some space. Don't tell. Okay. So, let me tell you what I was thinking, but okay, it looks like a false alarm. What occurred to me is, what if she doesn't have something up her nose? Like, what if she does have a blood clot or something? Then maybe it's not something you can pull out. But I think from reading this, clearly she has put something up her nose. She's embarrassed about it. And clearly when he tries to, we try to look at her, he tries to look at it, she pulls away. So I think the answer then is that we're going to distract her and then try to use tweezers. I don't think you want to use suction on someone else. So we're going to try a distraction. We're going to try to get this out now. F, K, B. F, K, Z. Okay, first we distract, then we tweezer. Zoe hides behind her father. You pull a stuffed animal out of a drawer. Penguin just had something stuck up her nose, too, you say. She thought it was scary. She could really use a hug. Zoe reaches out and hugs Penguin. May I try something else, you ask? Zoe nods. She's calmed down. Consider this action completed. I don't know what that means. Consider this action completed. Okay, the next thing we're doing is tweezers, RZN. I don't want to use a suction on a nose if we don't have to. That feels like we got less control. With the tweezers, we can actually see and know how much force we're applying. RZN is story card 17. Okay, now let's see if something bad's going to happen. Or if more likely, we're going to find this foreign object and it's going to be something that we have to worry about. Like, how did she get some drug or something? Whoa. You ask Zoe to hold still. You insert the tweezers in her nose. Wide-eyed, she whimpers as you locate the object. She struggles, and the object slips from the tweezer's grasp. This ends up pushing the object further in. Blood seeps out of her nose. As you prepare to try again, Zoe begins to choke. Emergency. Choose another procedure as part of the same action. If this procedure does not result in emergency resolved, ignore the procedure and take story card 13. Okay, so we're in trouble now. We are in trouble. She's choking. It pushed the object further in. We found the object, but we've pushed it further in, and now she's bleeding and choking on her blood. Should we do the suction now? Seems like we should do the suction, don't you think? The nurse was patting her on the back. Where are our options? We can do abdominal thrusts. That would be to get her to choke, but I don't think she's choking. Seems like suction. Okay, it's either suction or abdominal thrust. So let's look those up. Yikes, this got serious very quickly. Vitamins. Specialist tests. It's not tests, it's procedures. Okay. Abdominal thrust, emergency technique to clear the airway of someone who is conscious and choking. I guess that is what's happening. Let's see if suction is in here. Use a rubber bulb to hold or draw out an object. A rubber bulb. Oh, maybe I should have tried that. I don't think so. I think maybe abdominal thrust is what we've got to do. Clear the airway of someone who's conscious and choking. That definitely sounds like what's happening here. All right, I guess abdominal thrusts. Yeah, maybe suction is not likely to, we're not likely to be able to catch it with the suction. Abdominal thrusts. Okay, here we go. We're doing the abdominal thrusts. So it says do this as part of the same action. Abdominal thrust is YWQ. All right, hopefully this is gonna, hopefully we'll be able to save this person. Everyone's agreeing with abdominal thrust. Okay. YWQ. If you're currently in an emergency, see result KAV, which we certainly are. About to get sued, that's the emergency. If Zoe's choking, see result SFT. The object must have gone down to Zoe's larynx and blocked her breathing. Quickly, you start to give Zoe gentle abdominal thrusts. The short pulse of air forced the object up and out of her mouth. Emergency resolved. Oh my God, thank God. Yikes. That was scary. You clean up the object that was stuck in Zoe's nose to discover a pill. Yes, here we go. She's been taking drugs. She's got drugs probably from her parents or from her sister or her mother. N204. We're going to have to identify that. I thought it might be something like that. Okay, story card 26. With the object removed, Zoe's nose begins to bleed profusely. Nurse Judy says, this is abnormally heavy bleeding. Use one of these three procedures to stop the nosebleed as part of the same action. Have Zoe lie on her back and pinch her nose. Have Zoe sit up, tilt her head back and pinch her nose. Or pack the side of Zoe's nose that is bleeding with gauze. So my gut, as non-medical person, tells me that if it's abnormally heavy bleeding, we're going to need the gauze. But let's, before we make that decision, shouldn't we have been told to change the objects, the status? I guess we're gonna get a status update in a second, I'm guessing. A little strange that it didn't update our status though, but maybe we're still in the same action. We don't have information about these drugs, do we? Like, we can't identify that drug. Probably, I guess if we search on the internet, we could find it. There's a very good guess from Elaine. Maybe the pill is medication Daniel's taking for his heartburn. And Debbie says, look up nosebleed. They said not to tilt the head back. She might choke on the blood. Okay, good. We're going to do both of those things. First of all, we're going to look for drugs for heartburn that the father has and see if that might be it. We might also do an internet search for this, but I think your idea that it could be for heartburn is a very good one. Let's see. Let's see. Or blood thinner. Heartburn, cimetidine, stomach ulcers, headache, diarrhea, nauseousness, dizziness, drowsiness. Doesn't sound like that's what she's got to me. Is there anything else for heartburn? It's clearly a prescription drug, not something like aspirin. Prazole treats side effects, headaches, vomiting, no. Reduces stomach acid. See if the chat has found it. Okay. My guess would be a blood thinner causes aplastic anemia. The heartburn drug causes anemia. Yeah, but what heartburn drug, and why have we not? I mean, it feels like maybe we should just try to find that pill on the internet rather than guess. Rather than guess that it's this just because the father has heartburn treatment. But feels like we should be able to ask him about it. So let's finish this action first. So we want procedures. And we want procedures for nosebleed. Conditions, specialist procedures. What have we got? We have nosebleeds. Debbie says we shouldn't have to look it up. It should be in the game. Yes, that's why we're not going to worry about it for now. How about if it's not under procedures, we look up blood. No, okay. What about conditions? Nosebleed. Do not tilt head back, as this can lead to choking. Okay, so we know we're not going to have her tilt her head back. Lay on her back, tilt her head back. So neither of these. We're going to do the gauze. Q, K, X. And this is part of the same action. Okay, so we're going to do QKX. We have to do that now. We're told to do it right away. So we're going to do QKX. And then we will hopefully get an update on her. I guess it makes sense. After we stabilize her, then her status is gonna change. You pack the side of Zoe's nose that's bleeding with gauze. The blood pools in her nose. Before it can flow back into her trachea and choke her, the blood coagulates. You have stopped the nosebleed. Take status card SC2. Mysterious bleeding, then take story card 15. Okay, so her blood has clotted, so she doesn't have blood thinner. Okay. Where did I put it? QKX. Let me just get that again. Okay, story card 15 and status card 2. So her status has changed. No longer has an object in her nose, but she's got mysterious bleeding. And story card 15, maybe the father is going to recognize the drug now. You show the pill to Zoe's dad, Daniel. He says, it could be mine. I'm not sure. I don't like having to pay attention to things like this, so I just set up all my pills for the week in a pill dispenser. Look, here's what I take. You ask what each pill is for. Oh, let me get the list for you. So, does that look... This one looks green. I don't think it's in his set. Unless she's taken them all out and he didn't even notice. Let's see. It looks like he's got 4 different kinds of pills. Let's see if this list has 5 pills on it. Look at that. 1, 2, 3, 4, 5. Look at that. He takes 5 pills, and someone has taken all of these out of it, one of them out of it. And sure enough, there's the one for heartburn. So yes, someone is stealing them. Now, I'm not even sure it's her. It could be her older sister, and she's just gotten hold of one of them. The question is, which one is it? And I think what we're meant to figure out is it's not going to be a vitamin D. I don't think we can do it by looking at these. But I think she's taken one out of every day, so we should look at these drugs, and we think it's going to be the one that causes the drug stuff. But let's take a look at what these do and see if any could explain her being tired and all that. So lisinopril treats hypertension. So he takes all these pills. It can cause low blood pressure, dizziness, headache, can increase blood potassium. Doesn't sound like what she's taking. Then the one we looked at before, cimetidine, treats heartburn. He's still got heartburn, so she could be stealing that. Headache, diarrhea, dizziness. She doesn't seem to have those, but she does have drowsiness. And she does have, well, does she have aplastic anemia? Let's take a look at aplastic anemia. Aplastic anemia is bone marrow produced blood cells. Symptoms include headache, dizziness, nausea, shortness of breath, bruising, fatigue, nosebleeds, fever. I mean, she doesn't have most of those. Aplastic anemia. She doesn't have most of those. I don't love it. Let's keep going. What about Lipitor? Lowers cholesterol. That's not going to do anything for her. What about Zyrtec? Control allergies. Okay, so it's Cimetidine or lisinopril? What was the lisinopril? Treats hypertension, low blood pressure, dizziness, headache. So do we still think it's cimetidine, even though she doesn't match she doesn't match that all that well? Where's our anemia again? Where's general anemia? Fatigue, shortness of breath, headaches, concentrating dizziness, leg cramps. That's not great. And this is the one, potentially fatal disease. Inherited disorders. I mean, she does have a recessive gene for Fanconi anemia. Maybe that's exacerbating it. Okay. Diagnose with blood test CBC. Confirm with bone marrow biopsy. Does not produce enough blood cells. So if we thought that she was taking the cimetidine and that was giving her symptoms of aplastic anemia, maybe a CBC blood test would be what to give her. We still have one more time slot. Let's take a look at this new thing we have. So we could ask the questions we already asked. We asked all those questions. We could do a CBC blood test. We could talk to a blood specialist. I feel like we should probably do CBC. CBC feels like it would tell us we think she's got a blood problem. We think it might find anemia. All right, let's order a blood test, CBC. So we're in the second block of time here. So V and U. Let's see what we got here. VNU, story card 18. Zoe's test comes back with distressing results. Low red blood cells, low white blood cells, and low platelets. Okay, we're on the right track here. We are absolutely on the right track. Let's see now. Oh, well, I guess before we do anything, let's have her update. So we're at the 1600 TNV. I have a feeling her condition may not be great. The entire family is starting to get restless. They clearly expect to be in and out faster than this. Daniel checks his phone and sighs. Your mother still hasn't landed yet, he tells Zoe. Okay, so we're okay. We're okay. But as we suspected, she's got low blood tests. That sounds like she's got the... It sounds like she's got the side effects of taking the medicine of the father. Now, uncovers conditions such as anemia, low red blood cell count. So we think that's what it is. But now she also has low platelets and low white blood cell counts. Now, do we have to... Is that important for us? Where's our blood information about white blood cells? White blood cells help the body fight infection and disease. High white blood count usually indicates the body is fighting an infection. Low WC increases the risk of getting an infection. Potentially fatal disease where bone marrow does not produce enough blood cells. That's what we've got, aplastic anemia, both red and blood. History of taking certain medications or cimetidine. Oh, it's even listed here, cimetidine. And she's got recessive Faconia anemia from the father. Okay, so I don't know why she's not got dizziness, but she's got bruising and fatigue. We did a blood CBC and confirm with bone marrow biopsy. Okay, so we could confirm it with a bone marrow biopsy. Treat short-term symptoms with a blood transfusion. And then if she needed it, we'd do a blood marrow transplantation. I don't think we actually need that, though. Then identify and treat the cause. Okay, so first thing is we got a blood transfusion right now before things get bad. Okay, so we're going to order a blood transfusion. We know we're confident enough about what's going on that we're going to do a blood transfusion. I suspect that once we just stop her from taking these drugs, we don't need to do a bone marrow transplant because that's not the actual nature of her problem. It's not like a genetic disorders giving her low blood counts. It's the drug that's doing it. So let's give her a blood transfusion right now. It's not going to hurt. It'll cost her a couple $1,000s. They're not going to be thrilled about that, but it's not going to do bad. Do we need to check her blood type first? I don't think so. I think the blood transfusion people do that. What is blood test DEB? I mean, do we need to even... DEB is Faconia anemia. This would be something that we would do if we thought that she might have that, but we don't think she has that genetically. So we're just going to do a blood transfusion right now before things get bad. RLU. Just in case. I think that should basically solve it, though. I don't think she's going to need more stuff, to be honest, but I'm not a doctor. Story card 21. I wonder if she's going to freak out about this. Daniel asks if, as Zoe's father, he can volunteer to donate blood for Zoe's transfusion. I'm type O, so I'm a universal donor. You thank Daniel, but explain that it's not the best course of action right now. It takes time to collect a donation and test the blood, you say. Zoe needs the transfusion right now, but you're welcome to add to the supply for others in need like Zoe. Okay, so more example that the father is a good father. So story card 27. You secure AB positive blood from the hospital's reserves. Zoe is very nervous when you show her the needle that you're going to put in her arm. Zoe's half-sister Jasmine takes her hand. You can be brave, she says. I'll be here with you. Zoe whimpers when you insert the first needle, but otherwise doesn't make a sound through the rest of the setup. The transfusion will take a while, so you leave Nurse Judy with Zoe as you make your rounds of your other patients. Take story card 28. You check in on Zoe after her transfusion. She's sitting up in bed, playing with her half-sister Jasmine, smiling and even giggling. Congratulations. Zoe will survive the night. However, Zoe's condition was serious. She could have died. She still might, as you have only addressed her symptoms. You still need to identify the underlying cause of her excessive bleeding. And what about that green pill? Take status card C3, smiling and giggling. Okay, so the worst is over. We got her to smiling and giggling status. We believe we understand the nature of the problem here. We believe that we understand that she's not being abused. She's in a happy family. So I'm not sure we need the social worker anymore, but we're going to have to decide what her long-term treatment is going to be. So my guess is that she doesn't need any more treatment. She just has to stop taking the drugs from the father. I don't even know why she's taking them. Maybe she thinks they're candy. But we could do a bone marrow biopsy to confirm. What was the thing? This is the weird. It's a little weird, actually. I mean, maybe the medical people, maybe Marlene. This is an interesting thing. Let's talk about this for a second. So there is the condition known as aplastic anemia, which is possibly fatal disease. So if you had the disease of aplastic anemia due to an infectious disease or a history of certain medications or some genetic inherited disorder, you would confirm with a bone marrow biopsy, treat, and then restore the body's ability to make blood cells with a bone marrow transplantation. That seems very serious. And I think maybe look it up. The question is, if your symptoms are being caused by this drug, shouldn't, and especially a little kid, shouldn't your body recover on its own without a bone marrow transplant? And the second question I have is, will this test show up with a bone marrow biopsy? I guess it will. Just feels like she shouldn't need a bone marrow transplant. I'm going to look up what a bone marrow transplant costs. There's no costs in this game. It does seem like it's going to be a huge amount of money. I'm inclined to talk to a specialist about it, to be honest. Okay, bone marrow transplant. Replace damaged bone marrow with healthy blood-forming stem cells that are infused into the bloodstream. Bone marrow donors must have stem cells that match the person receiving the donation. Siblings are much more likely to be matched than parents. Only about 30% of people needing a transplant have a compatibly matched sibling. So maybe the sister can help her. Let's put it this way. They could always do another transfusion. Let's do the first test to confirm it. Then we can decide on treatment. They need to see the hematologist, and they will do all the testing she needs, says Marlene. Melissa says she's AB and he's O. I don't think he is her father, if I remember the grid. I don't think that's... I don't think... That doesn't... That's an interesting... That's an interesting thought. But, I'm type O. He's universal. You secure AB positive. So the idea about the father, I'm not sure why that matters much, but if the mother's is this and the child's AB, you're saying it can't be the father because that's interesting. Like, it still could be that the father is giving her these drugs. What if the father is forcing her to these drugs? I really wish it was clearer about the Zoe having AB positive, but I guess we're assuming that they would give Zoe the exact blood type she has. But does he know he's not the father? And if he's not the father, then we can't assume that his genetic history. Where's our list of cards? If he's not the genetic father, then we can't count on this. We can't count on his column. But it doesn't matter because Faconia anemia, the mother's not a carrier. Okay. Oh, okay. So it seems like maybe we're a bit split about whether to send her straight to the Debbie says AB positive is on her admission. That's a very good catch. We need to not be careless. We've got her blood type here, AB positive, in case we weren't sure. Okay, very good catch. So we don't think he's the father, so he could still be giving her this drug himself, but then why would he volunteer this? I don't think he knows. I don't think he is abusing her and giving her the drug. I don't think he knows he's not the father. So maybe we're going to want to talk to a social worker anyway. The question now is whether we do this bone marrow test or just talk to the hematologist. What does the chat think? Well, Marlene says doing an unnecessary bone marrow biopsy seems extreme. Okay, everyone thinks we should talk to the hematologist. That seems like a reasonable thing to me before we start doing biopsies of her bone marrow. So I'm happy with that. DHM, we're going to talk to the hematologist. Normally I don't trust these specialists much, but it does seem like in this case, you know who else could be useful? Like the pharmacist. The pharmacist might know, like, hey, she's taking. I bet the pharmacist can tell us can confirm this is that Cimadine drug. But the question is, could the pharmacist say, yeah, she's taking that explains it, and once she stops, she'll stop. I think we might talk to the pharmacist next. I bet you that pharmacist will confirm what this drug is. There absolutely is bone marrow. We can test and we can transplant. So is that, I think that's what Nelson was asking. Okay, we're talking to the hematologist first. And what are we hoping? What are we hoping to learn from the hematologist? I think we're hoping to learn. I'm not sure if he's going to be able to tell us the drug. On the procedures booklet, I see. I think we did see that there was a procedure, and it didn't tell us, it didn't make it sound like too bad. I believe there was an entry for the bone marrow biopsy. Confirm with bone marrow biopsy. So we could just confirm it. I don't know why there's not an entry for the bone marrow biopsy. Blood specialist. All right, we're gonna make a decision here. Let me look at the last input from the chat. Debbie says confirm the diagnosis. Well, that would be the bone marrow biopsy. Elaine says cimetidine isn't green. I bet it is going to be green, but I think we've got a little bit of time. So actually, I don't think we're in a rush here. We'll talk to the hematologist, and maybe we'll talk to the pharmacist. I'm quite curious if they can confirm what this is. DHM. Well, in fact, I think it's more important to talk to the pharmacist. So I'm going to actually change this. We'll talk to the hematologist in a second, but I think the logical thing to do is talk to the pharmacist and confirm what that drug is. The pharmacist is UEE. If the channel is saying they don't think it's green, I think this is going to confirm it's cimetidine, but that seems like the natural first thing to do then. Let's confirm what this drug is. You have received a card with the pill, which we have. Take story card 25. That's a cool little test. Okay, let's see what the pharmacist says. The pharmacist looks at the pill that came out of Zoe's nose. This is cimetidine for conditions that cause too much stomach acid, like heartburn, stomach ulcers, and reflux. What was a little girl doing playing with these? This could be bad. Cimetidine has some pretty severe side effects, including aplastic anemia. Okay. So we could choose blood test cimetidine as your action. We can actually do a specific test to confirm it. But we already know it. Yeah, I don't think we need it. I mean, I don't know. It depends whether the game was going to punish us for not verifying it. And it depends whether this does seem like, well, let's just put this aside. I don't feel like we have to do it now if we didn't want to. I'm just going to put this aside. Okay, let's talk to our hematologist. I guess we're hoping the hematologist can tell us that she doesn't need a bone marrow. But I feel like maybe the hematologist might say, are you sure it's cimetidine? Rob says, I wonder if it's red. No, it's not a red herring. It's the cause of all her problems. All right, I'm going to look this up. If it wants proof of cimetidine, I'm going to. So I hope this isn't just a waste. I fear that this action is going to be a waste, but we'll see. Story card 11. I feel like the hematologist is going to give us generic information, but we'll see. If you have a blood result, which we do, take story card 32. So I guess he knows we've done a blood test. Look at these CBC test results. A nosebleed alone would not cause these numbers to be as low as they are. If anything, the nosebleed occurred because her platelets are so low. To treat her immediate symptoms, give her a blood transfusion, but you also need to identify the cause. A bone marrow biopsy should shed some light on that. All right, so I predicted it was going to be useless. It does seem like it wants us to do a bone marrow. This is because cost is no object. They're just going to send this family a bill for $30,000. But it feels like this game wants us to do that. She's not going to heal by herself, and we're going to have to do a bone marrow biopsy. But first, we're going to get her 6 p.m. update. HSZ. HSZ is story card 6. Let's see. They're probably freaking out. They want to go home. Daniel sits with Zoe on his lap and Jasmine leaning on his side. Daniel says to the girls, this is not how I thought I'd spend my wedding anniversary. Chandra's on a business trip and we're stuck at the hospital. I was going to take you out to celebrate tonight, Zoe. And not me, demands Jasmine. You're going to be home with your dad, says Daniel. What are you getting Mom for her anniversary? What are you getting Mom for her anniversary? Asked Zoe. Well, they say you buy fruit or flowers for the 4th anniversary. Zoe and Jasmine laugh. Ha, fruit for an anniversary. That's hilarious. Daniel smiles. Yeah, I think so too. Boy, this guy is not going to be happy when he finds out he's not the father. Yeah, business trip. Rob thinks she's sleeping around. That's going to be rough. All right, but I guess this game wants us to do a bone marrow biopsy. I don't like it, but I think we're going to have to do it. All right. Well, let's go ahead and do the bone marrow biopsy. I don't know what else. We could just send him home, but surely not. VFC. I mean, maybe this will confirm that she needs the transplant. We were trying to do it in a different way. VFC is story card 9. To perform the bone marrow biopsy, you need Zoe to lie on her stomach. This is good because now she won't be able to see the large biopsy needle. You'll need to insert into her back to draw marrow from her pelvis. Is it going to hurt? Zoe asks. Just a little bee sting, you say as you give her a local anesthetic. Zoe's half-sister, Jasmine, asks to be present to hold Zoe's hand while you perform the biopsy. A large needle into her back. Well, this is an interesting choice here. Any thoughts from the channel? Nelson doesn't want her to stay. She sure did help calm her down. I think Jasmine is a good influence on her. I think we should let her stay. But it might be a little scary for her. She seems pretty brave, though, Jasmine. And she just wants to hold her hand. Melissa says, it's usually a sterile procedure, but you do you. I think we should let her stay. I think we should let her stay. All right. There's a lot of risk if she creates some confusion. All right, I'm letting her stay. She's got a good history of helping. I'm going to let her stay. Ooh. Zoe's half-sister, Jasmine, holds her hand. Jasmine's eyes widen as you pull out the huge needle. Zoe says, what is it? What do you see? Zoe turns around and sees the needle. She screams. It takes 20 minutes before Zoe's father can calm her down enough to proceed. Mark an X for your next action. Lose this action. So that was not the right thing to do. So Jasmine's wide eyes made Zoe turn around and see this scary looking needle. Yikes. Okay, but it proceeds. You send Jasmine out of the room with Nurse Judy. Zoe's father holds her hand and while she whimpers. You may feel a little pressure, you say, as you insert the large needle. Fortunately, any pain is brief and usually dull. There, you say, all done. The lab returns with its analysis of Zoe's bone marrow biopsy. The results are distressing. Zoe likely has aplastic anemia. Okay, now the really bad news is going to come. Because we're going to have to tell her that she needs a transplant and her father is not her father. I don't know if we need to involve the social worker here. Really? She needs a transplant instead of just stop taking that drug? Can't she just stop taking the drug? Has it caused that damage to her sufficient that she needs a transplant? What does everyone think? Do we need to just schedule her for this transplant? Debbie says the bone marrow is already damaged. Wow. Well, we talked to the experts. They didn't give us any help. I mean, I would like to get on the phone and call up the hematologist and say, is it damaged? Does she really need a transplant? But it seems like the game is saying she does. So I guess we'll just get her on the schedule. Hopefully she has good insurance. MKG. I'm doing a bone marrow transplant. It may give us a choice about the father. Let me just... We know we don't need to do any of these, but let me just look at these blood tests and make sure we shouldn't be doing any of those first. Oh, here's the bone marrow biopsy. Blood transfusion. Bone marrow donors must have stem cells that match. Siblings are more likely to be matched. Yeah, that's going to be important for us when we do our recommendation. I just want to make sure there's not some blood tests we should be doing first. Where's our list of... Oh, here. Just want to look at the other blood tests. Complete blood count, no. 7 substances, no. Fanconi anemia. Blood scan. Blood work, no, I think we're okay. All right. It doesn't heal, says Marlene. You don't get better. Okay, that's it. Bone marrow transplant, MKG, and we'll see if the game is going to ask us something about the father. If you have a card with the bone marrow, which we do, it's this card here. Then result is DYM or DVM? DYM. DYM says card 20. Yeah, let's see. You bring in the hospital's transplant coordinator. Zoe's bone marrow is failing to produce enough blood cells. We need to transplant healthy marrow from a matching donor. Daniel rolls up his sleeves. Tell me what I need to do. Does Zoe have any siblings? There's Jasmine, her half-sister. She's from Chandra's first marriage. You know what? She might not be her half-sister. She might be her full sister. Story card 30. The wife is off on a business trip during their anniversary. The transplant coordinator says the best donor would be a full sibling, someone with the same mother and father as Zoe. Since Zoe has no full siblings, it's unlikely any of you are a match. I've already searched the registry. There's no matching donor for Zoe in the system. It can take months or longer to locate a match. There's a risk of complications as well that could lead to her death if we don't find a donor soon. I wish we had better news for you. I think it's going to be the sister's the full sibling. And I'm hoping it's going to give us a choice now to test Jasmine. A bone marrow transplant is clearly what Zoe needs, but without a donor, she's going to have to wait. You consider if you have addressed all of Zoe's symptoms and whether you understand the cause of them. You can keep working with Zoe until you're ready to complete your final report. However, you can't help but think there's something important you're missing. Take story card 7. Something's just not adding up. If you know what it is, write it down on Zoe's patient chart, then read the result relating to what you've written down. You may pick one. This does not require an action. Before filling in your final report, if you didn't find what's not adding up, take story card 34. I guess what we think the answer is the blood type, right? We think her blood type is not adding up. And when we say the blood type's not adding up, that will hopefully cause the doctors to reevaluate Jasmine. Okay. So we're going to say A or B, blood type. We're hoping that they're going to test Jasmine. We don't have an option to test Jasmine, right? I suppose the social worker might pick up on it, but none of these others will. Okay, we're going to say the blood type's not adding up, and we're hoping that that's going to prompt them to test Jasmine. Or, yeah, A or B. Take story card 33. When you check the blood type chart to confirm your suspicion, you realize you're right. Zoe's blood type is AB positive. That means her parents must have blood types AB or AB, not type O like her father, Daniel, which means he isn't her father. Daniel's phone rings. It's Zoe's mom, Chandra. After Daniel catches her up, you ask to speak to Chandra privately. Confused, Daniel hands you his phone. You step out of the room. Mrs. Williams, is it possible Daniel is not Zoe's biological father? I've always feared this. I met Daniel the week after Michael and I separated. She pauses as if afraid to say these next words. It's entirely possible Daniel's not Zoe's father, and if he's not, then Michael is the father. You finish her thought, and Jasmine would be a full sibling of Zoe's. Just what we started to suspect. It doesn't take long to confirm Jasmine is a donor match for Zoe. Chandra talks to Daniel, then calls Michael to share the news with him and get his consent for Jasmine to donate bone marrow to her sister. Jasmine looks confused and a little scared, but she agrees to help her sister. The bone marrow transplant is a go. It's time to fill out your final report. What was the cause of Zoe's symptoms? What treatments did she require? What recommendations do you have for her and her family? When you've completed your final report, read the epilogue. All right, so I think what we'll do is we've been playing for 2 hours because we were supposed to take a break every hour, but we got so carried away with the danger, the kid choking, that we've just been going for 2 hours. So what we'll do is we'll take an 8-minute break. We'll come back. We'll fill out the final report together. We'll read the epilogue, and we'll talk about the experience, give some thought to what's going to go into the final report, and I'll see you in 8 minutes. Okay, we're back. ready to write our final report on patient 1 in Miami Flatline. I do believe we have figured out all of the details of what's wrong, but there is still the subtlety of the final report. Checking in with the chat. Well, I guess let me not comment on the case. We'll give a review. We'll talk about this experience after we finish it. But let's go ahead and finish it. Okay, it says, for our final report, what was the cause of the symptoms, what treatments, and what recommendations? I think it's the recommendations that are going to be trickiest here. So let's go ahead. Okay, so she has been eating father's cimetidine pills. Side effect is the aplastic anemia. Okay. What treatments did you provide? And we did a bone marrow transplant. That's basically, and we also removed nose blockage. Stopped the bleeding. I suppose for the record, we gave her a blood transfusion. Okay. I guess we also did a biopsy to confirm cause. Okay, now, recommendations. I mean, so Zoe must stop stealing. Father, keep drugs away and safe. Now, maybe he should consider stop taking those. Now, what are we going to do in terms of the social ramifications? And should we spend... So as was pointed out, we just finished the bone transplant in the nick of time. But remember, the game says if there's still stuff you want to do, you can do extra stuff. It will just take you a little penalty and score. And the only thing that we might consider doing is calling in the social worker. Why might we do that? I mean, I guess the idea is that this family is gonna... Is the family... Is the father gonna freak out? The father's gonna figure out, right, that he's not the biological father. So the question is whether we want to get a social worker involved. I mean, certainly we're going to recommend, but is it worth it for us to call up the social worker before they leave the hospital? Or is it none of our business? Debbie says, I don't think we need to do anything else. Their family dynamics are not our business. The family seems happy enough. I think we already told Daniel. Debbie says the social worker would only be needed in cases of abuse. They're not really there just to give marriage advice. I think you might have a point there. And maybe it's none of our business. I guess it's really none of our business. He may react poorly to this. I'll tell you what I would do if I was the doctor. I would take Daniel aside, tell him how great he did as a father. I mean, the daughter had something up his nose. He was smart enough to bring her to the emergency room. He volunteered to give transplant, give blood. Like, I think we need to tell him that, like, he's an amazing father to Zoe. At least try to give him some positive thoughts while he negotiates whether he might not be the biological father. Beyond that, it's not really our business. But you're right. She does. I guess it does say that she told him. Chandra talks to Daniel, then calls Michael to share the news with him and get consent. All right. Well, we've done what we can do. Let's read the epilogue and get our score. Before I read it, anyone want to add anything to the final report? Because this is where we can lose score if we forget something. The cause was eating the father's cimetidine pills. Side effect was aplastic anemia. We did a biopsy to confirm it. Then we did a bone marrow transplant. Before that, we removed the blockage, stopped the bleeding, and did a blood transfusion. Our recommendations: Zoe has to stop stealing her pills. Father has to keep them safer. And then we're going to take Daniel aside and tell him how great a father he's been to Zoe and that he saved her. All right. If no one has any other alternative ideas, we're going to go ahead and read the solution. Last chance. Did Zoe actually steal the pills? Maybe she was force-fed. Well, that was a theory, but I think from everything we've seen, we don't believe that the father is doing that to her. Could it be a Munchausen by proxy situation? I don't think so. She's got it up her nose. She's obviously playing with it. Yeah, I don't think... Zero evidence. Yeah, I agree with Debbie. Okay, here we go. We'll find out. Don't read the epilogue until the game tells you to. But it does say do it and then read the epilogue. I mean, we could call the social worker. The social worker could talk with Zoe. I mean, hold on. Before we read the epilogue, I mean, the social worker could talk with Zoe You could find out that Jasmine was feeding her the pills. Maybe it would be smart to have the social worker talk with Zoe just to rule out. Does seem like it's unlikely, though. They're too good friends. They're too good. Okay. All right. No one wants to bring in the social worker. I guess I kind of agree with you. All right. No bad family history. Social history. Lives with father and mother, half sister, lives in home half the time, attends preschool. All right, we're not going to bring in the social worker. It's more trouble than it's worth. Here we go. Zoe's not the first child to put something up her nose, nor will she be the last. Tweezers can push an object further up the nose to become a choking hazard. If you did this, you'd need to apply abdominal thrust to dislodge the object before Zoe stops breathing. If Zoe stops breathing, CPR and ambubag would help her recover. You could attempt to use the ambubag to force the object out of Zoe's nose. However, this is likely to frighten her. You need to distract her to calm her down again. Suction removes the object from her nose without forcing it further up. That's a good lesson in the future. You discover the object is a green pill. However, Zoe's nose starts to bleed excessively. If you have Zoe lay on her back or tilt her head back, blood can flow back into her trachea. In addition to potentially causing her to choke, the experience will be traumatic. Packing her nostril with gauze allows the blood to coagulate and stops the nosebleed. Running a CBC blood test would reveal Zoe's blood count is extremely low. Excessive bleeding combined with low blood count can be life-threatening. A blood transfusion helps Zoe restore her blood count to healthy levels to ensure she will survive the night. But what caused the bleeding and her low blood count? To find the cause, you can perform a bone marrow biopsy. The biopsy shows Zoe has aplastic anemia. But what caused it? You could rule out a viral infection with a virus test, but Zoe doesn't show signs of an infection. You can rule out Fanconi anemia either by running a blood test DEB or asking Daniel about genetic disorders. Fanconi anemia is a recessive genetic disease, so both parents would have to be carriers. You can rule out lupus with a blood test ANA. However, lupus is rarely seen in children under 5. What about the green pill? Daniel says he takes 5 pills a day. There are only 4 pills, none green, in each of his pill holder slots. Daniel has been complaining about heartburn, which is what the cimetidine is supposed to address. So where are the other green pills? The green pill as cimetidine. You could consult the pharmacist. She can identify the green pill as cimetidine and run a blood test on cimetidine to confirm Zoe has been eating the green pills long enough to have developed aplastic anemia. Okay, well, we skipped that because we were so sure. A bone marrow transplant is necessary to enable Zoe's body to make new blood cells. However, she needs a matching donor. The best donor is a full sibling, but Jasmine is Zoe's half-sister. At this point, you might have the feeling you're missing something important, and that something is that Daniel is blood type O. Reviewing the blood type chart, it's impossible for a child with AB positive blood to have a father who's O negative. A call from Zoe's mom, Chandra, confirms the possibility that Jasmine and Zoe are full sisters. Turns out Jasmine is a full match and the bone marrow transplant is a go. All right, here we go. Let's see if we can do this without giving stuff away. I guess I could use my cubes here. Okay. First score is 40 points if Zoe survived. Yeah, we got that 40. 10 points if you clear the object, and 15 points if you determine she has aplastic anemia. -5 if you gave her acetyltheoprene, chloroquine, ibuprofen, or prednisone to treat her for lupus. Okay, we didn't do that. Plus 10 points if you discovered cimetidine was the cause of her aplastic anemia. We got that. Plus 5 points if you gave her a transfusion to restore her blood count. We did that. Plus 5 points if you consulted with the social worker. Even though they're likely caused by aplastic anemia, you should confirm Zoe's bruises do not indicate physical abuse. Okay, that's not fair. I don't feel like I feel like we could. I'm happy about our decision. Okay, 5 points if you recommended Daniel prevent Zoe from accessing his pills in the future. We sure did. Keep drugs away. Okay. 5 points if you report Daniel for child neglect. Specifically, he neglected to keep his pills away from his daughter, almost leading to her death. Neglect leading to endangerment is a must report for health professionals in Florida. Well, we did see that thing, but we disagree with this. I disagree with this. That is totally... Daniel has enough problems. Who knows? Kids can get anywhere. I don't agree with this. Reporting someone to child services because your daughter got into some pills? No, that's going too far. That's going too far. That is going too far. All right, let's calculate our score here. 40, 50, 65, 75, 80, 85. Well, we'll just take our 85. I don't believe this is the good advice. This one, arguably. This one, no. Okay, 85. Now let's look at the second half. All right. So if we revealed a card with 15, I don't know why we need a card for that. But did we have a card with that? Seems like we figured out there wasn't the father, but it wanted us to find a card with that? That's weird. But we had the phone call. She told us. So I don't really understand that. Like, it's saying if we had a card to indicate that, we would get the bonus. But we don't have a card. So one of the cards must have confirmed it. But wait, maybe we do. Oh, we do. We do. That was the blood test. Okay. So we got 15 points for that. We lose 5 points for trying to use the tweezers. But we don't lose 5 points for not addressing. We don't lose 5 points for doing CPR. We don't lose 5 points for tilting her head. And we don't lose points for taking too long to get the thing out. So we've got 15 minus 5. So that's 100 minus 5. So we got 95 points. We've got 95 points, but I feel like at least these 5 points we don't agree with. So I'm going to give us +5 for not calling protective services. So that's a 100-point score as I see it. But now we've got a little extra story, card 38. Let's see. Zoe has a speedy recovery and has a huge smile on her face thanks to her sister's bone marrow donation. That's all still a shock to me, says Daniel. I can't believe my little girl almost died because I was careless. He hugs Zoe and Jasmine. No matter what the future holds for our family, you'll always be my little girls, both of you. Wow, that's a good father. I really don't think he should blame himself. A cool little card ending. Okay. So, you know the drill. We have to take a perfunctory pro forma break before we review this game. So I'm going to put us on a 1-minute break. Then we'll talk about the game. All right, we did it. We saved Zoe. We saved the family. Pretty good. Pretty good job from the whole group here. Even though there was a little bit of a mutiny in the beginning, we did slow down. We got it solved. We took a nice, long, leisurely time getting this one right. I guess we were a little bit paranoid, but we did resolve it. We got a near perfect score. The game wanted us to report the father to Child Protective Services. We decided to use a little discretion and not do it. Let's see what everyone thought. I think we should give ourselves the points. Anyway, we figured out no explanation on how she got the pills. We just keep going with the kids are really dumb. Seems pretty unrealistic she would keep eating them. Meds are never yummy. It is odd that she would keep eating them even if they didn't taste good. Nelson says, just repeating what I said before, I love this game, the added tension that life-saving decisions bring to a mystery game. Perry says, the law requires even the possibility of abuse to be reported. Yeah, I stick with my position. I am not, like, Child Protective Services is a very blunt instrument. I am not calling Child Protective Services because the 5-year-old daughter got into something. No, that's just, you warn the father, you got to take better care, put things, hide things, keep them away. But kids get into things. That's just the nature of kids. Okay, let's take a look at the cards we didn't see. So only a handful of cards that we didn't see in the course of this scenario. Let's just take a quick look at them. So this is if we tried to use this to dislodge it. She doesn't like it. You need to calm her down. We just agitated her. She was choking and we didn't properly stop it. She stopped breathing. That would be terrible. I think we tilted her head back. Things got worse. I don't feel safe here, Daddy, she says. If we took too long to take the thing out of her nose, she freaks out. And she's running. I guess we just have to distract her or something. I think this is if we got to the end and didn't give her the transplant. I think maybe if we didn't figure it out, this is the card that sort of tells us the answer, rather than us figuring out the answer on our own. And then lastly, she's turned blue, crash cart, CPR, and coughs up the pill. But that's pretty drastic. So she would have coughed up the pill with this. So she would have been okay, but you would have lost 5 points because someone else had to save her life. All right, so let's talk about this a little bit. I mean, this is everything. This is why we loved the first box of this game. We have a real mystery with some real subtle things to figure out, and a hell of a lot of tension. Tension because things are on a very tight clock with events occurring and people getting worse. We had a situation where the girl looked like she was about to die. We had an emergency. We had to pick the right action. We had a real mystery. We had real psychology. At first, we thought maybe the father was abusing the girls. Maybe I thought the sister was abusing her. Like, it was fraught. And with all the subtleties of the test, you learn a little about medicine and problems. I mean, that was great. And then the storytelling here, where we got a little epilogue, the detailed scoring, the arguing about the scoring. I don't know that, I mean, this is just an exceptional system done exceptionally well. Very impressed. Okay. Now, should we play case 2 tomorrow? Debbie says there's no possibility of abuse. It's a happy, healthy family. We already knew what caused the bruising and tiredness. A social worker couldn't tell us anything we didn't already know. Debbie and Nelson, these are the two people in the chat that were most interested in making sure I scheduled this so that they could join. We are willing to play tomorrow. So let's do that. What we'll do is when I'll end the stream now, I'll go and I'll update the Sunday 1 p.m. playthrough and mark it that we'll be playing patient number 2 tomorrow. So tomorrow we'll be playing patient number 2. Mick Irons. He's brought in by a rowdy group of surfers. Mick has hit his head and is confused. His friends are worried and want to help. Quickly open this. Okay. Thank you for joining me. Thank you for your help. If you like this content and want to see more of it, you might give it a thumbs up. Leave your thoughts in the comments if you're watching this after the fact. Another thank you to the Patreon supporters who make it possible to bring these games to the channel. And I'll see you tomorrow.